An elderly doctor once told me, "Did you know that many people use castor oil on its own, while they could add a simple ingredient to boost its effectiveness in unexpected ways?" I asked about that ingredient, and he replied, "Baking soda." Indeed, when properly combined with castor oil, you get a mixture capable of addressing problems that may seem outdated. I was truly astonished by this conversation, but the doctor explained every detail to me. I took note of it all, and now I am presenting to you all the uses of this amazing mixture. I believe that some of these applications might make you pause the video and reflect, just as I did when the doctor shared this with me. Use number 1. Relieving joint pain and arthritis. Joint discomfort is a common issue, particularly as we get older. Some folks recount memories of a grandparent warming up a couple of tablespoons of castor oil, combining it with 1 tablespoon of baking soda, then gently massaging the blend into the knees, knuckles, or wherever stiffness flared. The story goes that castor oil, rich in ricinoleic acid, calms inflammation, while baking soda's alkalinity may reduce localized acidity. After about 5 minutes of rubbing in small circles, they would wrap the joint with a warm cloth or bandage, sometimes placing a mild heat source like a heating pad for 20 to 30 minutes. If you've ever woken up with stiff knees and wondered if there's a simpler approach, this is one that older doctors themselves have reportedly tried. Of course, they caution not to do this over broken skin, or if the joint is severely swollen, and to avoid sleeping with a heating pad on. It's also helpful to remember that while the method can soothe, it doesn't replace professional medical interventions for serious arthritic conditions. If itching or irritation occurs, it might be best to reduce the baking soda or omit it. Use number 2. Soothing hoarseness and throat strain. Picture someone returning from cheering at a grandchild's sports game, only to find their voice nearly vanished from all the excitement. In older circles, there's a gentle approach that doesn't involve swallowing any medication. Mixing 1 teaspoon of castor oil with half a teaspoon of baking soda, warming it slightly until it's comfortable to the touch, then applying this around the neck. Softly massaging from under the jawline down toward the chest for about 5 minutes is believed to help relax tense muscles in the larynx. Afterward, some like to wrap a light scarf around the neck for an additional 20 minutes. Castor oil is valued for its potential anti-inflammatory effect, and baking soda may help soothe external irritation. It's important not to ingest castor oil in this scenario to avoid unwanted laxative effects. If hoarseness lingers more than a couple of weeks, or is accompanied by serious discomfort, seeking medical advice is recommended. Use number 3. Easing constipation and colon cleansing. Internal use. Some older doctors mention they grew up in households where a dose of castor oil was the go-to remedy for occasional constipation. They recall that taking 1 to 2 tablespoons of food-grade castor oil, often on an empty stomach, frequently spurred bowel movements within a few hours. Nowadays, a handful of individuals add half a teaspoon of baking soda dissolved in a glass of warm water before or after taking the oil, hoping to lessen any stomach upset. Castor oil triggers contractions in the intestines, while baking soda, being an antacid, can reduce discomfort or acidity. However, it's wise to approach this with caution. No one wants a sudden surprise if the laxative action is too strong, so staying near a bathroom is advisable. This is not suitable for pregnant individuals, unless a doctor specifically approves, or those with symptoms that might point to appendicitis or a bowel obstruction. As always, if constipation persists or worsens, a more thorough medical evaluation may be necessary. Use number 4. lightening dark spots and hyperpigmentation. Over time, especially past midlife, many notice dark spots cropping up, sometimes referred to as age spots or sunspots. One non-chemical approach involves mixing a teaspoon of castor oil with an equal amount of baking soda to form a paste. Gently spreading this onto the discolored patch for about 15 minutes before rinsing with lukewarm water might gradually soften the appearance of these spots. Enthusiasts claim that baking soda acts as a mild exfoliant while castor oil hydrates and may balance pigmentation. If you want to see whether your skin brightens slightly over the course of several weeks, you could consider trying this 2 or 3 times weekly. Those with sensitive skin should do a small patch test first, and if spots change in shape, color, or size, it's crucial to consult a professional without delay. Imagine the difference these simple time-tested remedies could make in your everyday life. Stick around, because the next tips might surprise you even more. Use number 5. Lightening underarms and reducing odors. It's not uncommon to see older adults hesitant about strong deodorants that irritate sensitive underarm skin, prompting a search for gentler solutions. One suggestion is to dissolve half a teaspoon of baking soda in warm water, rub the solution onto the underarms for several minutes, then rinse and pat dry. A few drops of castor oil are then massaged into the area to help lock in moisture. Baking soda's alkaline nature has long been prized for its odor-neutralizing effects, and when combined with a basic exfoliation, it can gradually lighten underarm darkness that builds up over the years. Could this be a refreshing alternative to more commercial options in your own daily routine? Feel free to let us know in the comments if you decide to give it a try. Use number 6. Reducing old scars and dark marks. Old scars might hold memories, some good, some not so pleasant, but occasionally people wish to fade them a bit. By creating a paste of 1 teaspoon castor oil, 1 teaspoon baking soda, and possibly a drop or 2 of lemon juice, if your skin tolerates it, you can gently massage the scar for 2 or 3 minutes, then let the mixture sit for about 15 more before rinsing. The hope is that baking soda's mild abrasive nature helps remove dead skin cells. Castor oil's ricinoleic acid supports skin regeneration, and lemon juice can deliver a slight brightening effect. Realistically, thick or deeply pigmented scars won't vanish instantly. However, older individuals who have used these substances for years sometimes report seeing a gradual improvement in the scar's texture or color. As always, caution applies when introducing acidic elements like lemon juice, especially under strong sun exposure or on newly healed skin. Use number 7. Calming eczema, psoriasis, and other irritations. Chronic skin conditions can sometimes plague seniors who long for gentler ways to soothe itchiness. A straightforward recipe blends half a teaspoon of baking soda with a tablespoon of castor oil. This can be lightly patted onto irritated areas, left for about 20 minutes, and then wiped away. Castor oil may deeply moisturize and keep the skin from drying out, which is vital for conditions like eczema, while baking soda can reduce some of the acid-based irritation in the skin. Of course, open sores or severe inflammations might require professional assessment, and if your skin is sensitive to baking soda, a patch test is crucial before broader application. If you don't have castor oil or baking soda, you'll find trusted links to purchase them in the description below the video. Use number 8. Softening the look of stretch marks. Stretch marks, whether from a growth spurt, weight fluctuations, or pregnancy, are a common concern for many older adults as well. A technique involves warming 2 tablespoons of castor oil, just enough to be cozy, and stirring in 1 teaspoon of baking soda. By massaging this mix into affected areas like the abdomen or thighs for 5 minutes and leaving it another 30 before wiping off, users hope to see subtle fading over time. Castor oil is believed to bolster skin elasticity, while baking soda gently exfoliates. Although these lines rarely disappear entirely, some find they become less pronounced after consistent application. If you're curious whether this might help you, you could do it daily or every other day. Those who are pregnant or nursing should confirm safety with their doctor, but as an external application, castor oil is generally seen as mild when not ingested. Use number 9. Softening corns and calluses on feet. Many seniors remember those days of wearing shoes that pressed the toes too tightly or working long hours on hard floors, eventually leading to corns or calluses. A recommended approach is to soak the feet for 15 minutes in warm water with a tablespoon of baking soda, then pat them dry. Next, a paste from about half a teaspoon of fresh baking soda and a tablespoon of castor oil is layered onto problem spots. Covering it overnight with a bandage can soften the toughened skin, allowing a gentler filing the following morning. Some older people who tried this method in their youth found it surprisingly effective, especially if they repeated it for several consecutive nights. Naturally, anyone with diabetes or poor circulation should check with a professional, as foot problems can be more complicated under those conditions. Use number 10. Easing heartburn and indigestion. Internal use. Occasional heartburn strikes many in their golden years, whether triggered by a beloved spicy dish or certain bedtime snacks. Baking soda is recognized as a simple antacid, so some dissolve a quarter teaspoon in water and sip slowly. A few individuals will add a mere drop of castor oil, speculating that it creates a thin film that might reduce irritation in the stomach or esophagus. Though this is not a mainstream method, it showcases another inventive spin on the castor oil and baking soda duo. If reflux becomes persistent or severe, doctors emphasize the importance of further evaluation, as the problem could involve structural or chronic issues like GERD. And of course, one must avoid large amounts of castor oil here to prevent that notorious laxative effect. Use number 11. Stimulating hair growth on the scalp. Thinning hair or a receding hairline is a concern shared by both women and men as they age. If you chat with certain older folks who tried natural scalp treatments, they might mention a mixture of 2 tablespoons of castor oil and 1 teaspoon of baking soda. They apply it directly to sparse areas, massaging gently for about 5 minutes to invigorate circulation, then letting it sit for half an hour under a shower cap or towel. Castor oil's vitamin E and fatty acids are acclaimed in some circles for helping hair appear thicker, while baking soda acts as a mild cleanser, removing any buildup that might block follicle activity. Rinsing well, sometimes twice, is essential due to castor oil's thickness. While results are anecdotal, many long-time users say their hair looks healthier, with fewer breakages. Use number 12. Soothing muscle, aches, and back tension. Have you ever awakened to a stiff back and thought, there must be a mild way to ease this without strong medications? According to certain older individuals, a homemade rub of 2 tablespoons of warmed castor oil, 1 teaspoon of baking soda, and a drop or 2 of peppermint or eucalyptus oil can be massaged over sore muscles for about 10 minutes. The castor oil is said to reduce inflammation, while the baking soda may help neutralize acid buildup like lactic acid in tired muscles. Some then apply a warm towel for another 20 minutes to deepen the relaxation. This is purely a soothing measure for general muscle fatigue. If there's sharp pain or a serious injury, it's critical to get professional attention. Use number 13. Speeding recovery from sprains and bruises. Life is full of small mishaps. Maybe you twist your ankle stepping off a curb or bang your arm on a kitchen counter. A mild approach for minor sprains or bruises, nothing too severe, involves 1 tablespoon of castor oil combined with 1 teaspoon of baking soda. People spread it on the affected area, then secure it loosely with a soft bandage for a few hours or overnight. Some older doctors mention that castor oil can encourage circulation, helping to drain excess fluid from a sprain, while baking soda potentially reduces inflammation and local acidity from bruising. If there's a possibility of fracture or severe tissue damage, though, professional medical evaluation is essential. Use number 14. Supporting the lymphatic system and immune health. In more alternative or holistic circles, castor oil packs are sometimes hailed for aiding lymphatic drainage. The simpler version of this practice combines 2 tablespoons of castor oil with 1 teaspoon of baking soda. After soaking a cotton cloth in the blend, an older friend of mine would place it on her upper abdomen, cover it with plastic or a towel, and then add a warm compress for about 45 minutes. She believed it boosted her immune resilience, especially during seasons of colds, by stimulating certain reflex points under the ribs. While evidence is largely anecdotal, some small studies hint at heightened white blood cell activity. One might wonder, is there a personal experience you've had with castor oil packs? Feel free to share your thoughts. This method is not advised, however, for those with acute abdominal pain or uncertain medical conditions without professional guidance. Every method we share is a piece of wisdom passed down through generations. Keep watching, and you might just uncover the perfect solution that speaks to your own experience. Use number 15. Whitening teeth naturally. Teeth can lose their whiteness over decades of enjoying coffee or tea or simply the passage of time. Rather than opting for strong bleaching kits, some prefer gently scrubbing their teeth once or twice a week with a paste made of 1 teaspoon of baking soda and half a teaspoon of castor oil. A soft bristled brush is recommended, and brush for about 2 minutes, concentrating on any stains. Baking soda's grit helps dislodge surface discoloration, and castor oil is thought to lubricate and break down some of the fatty components in stains. Afterward, a thorough rinse with water and then regular toothpaste can help restore freshness. Those with sensitive teeth may reduce frequency or avoid the method entirely if discomfort arises, since baking soda, despite being mild, can be abrasive when overused. Use number 16. Improving gum health and refreshing breath. Over the years, many older individuals develop gum sensitivity or modest gum recession. Dissolving half a teaspoon of baking soda in warm water to create a quick mouth rinse can neutralize acids that contribute to odors, after which a dab of castor oil might be massaged along the gum line. Castor oil has been lauded for its soothing nature, potentially reducing mild inflammation, and baking soda can assist with controlling harmful bacteria in the mouth. Of course, this is not meant to replace flossing, brushing, or routine dental visits. If there's significant swelling, persistent bleeding, or pain, professional care remains paramount. Be sure to check out the description for reliable sources to get these essential ingredients and enhance your wellness routine. Use number 17. Speeding healing of small cuts and scrapes. Small wounds, like a paper cut or minor kitchen knife nick, are an inevitable part of life. When they're superficial, some older individuals recall applying a tiny mix of castor oil and a pinch of baking soda to keep the wound moist and less susceptible to bacteria. They'd gently bandage it, changing the covering twice a day. Castor oil forms a barrier thought to foster a moist, healing environment, while baking soda might help curtail bacterial growth. This approach should only be used on clean, shallow cuts without signs of infection. If redness or drainage worsen, it's time to let a medical professional take a closer look. Use number 18. Anti-wrinkle mask for fine lines. Those fine creases around the eyes or across the forehead can sometimes become more visible with age. One gentle mask involves mixing 1 teaspoon of castor oil, half a teaspoon of baking soda, and optionally, the contents of a vitamin E capsule. By spreading this over areas prone to wrinkles, leaving it for about 15 minutes, and then wiping it off with a warm cloth, some users notice a temporary smoothing effect. Castor oil deeply hydrates the skin, and mild exfoliation from baking soda helps reveal fresher layers. While it won't erase deeply etched lines, older people who keep up with a regimen of hydration and gentle exfoliation can enjoy a softer, well-moisturized look. Always avoid getting the mixture in your eyes and discontinue if any irritation arises. Use number 19. Clearing blackheads and clogged pores. Blackheads can persist well beyond adolescence, lingering on the nose, chin, or forehead. A short, steaming session to open pores, followed by a cautious massage with a mix of 1 teaspoon of castor oil and 1 teaspoon of baking soda, might dislodge some of the trapped sebum. Advocates say baking soda provides a slight abrasion that unseats debris, while castor oil seeps into and loosens stubborn buildup. After a minute or two of gentle, circular motions, leaving it for 5 extra minutes, then washing off with warm water can help. It's wise to apply minimal pressure and possibly follow with a splash of cool water to close pores afterward. Overscrubbing can irritate the skin or spread bacteria, so a balanced approach is key. Use number 20. Soothing minor sunburn or mild burns. Sun exposure can catch us off guard. Even seniors who diligently apply sunscreen might miss a spot or remain in the sun a bit too long. If the burn is mild, red but not blistered or severely painful, a baking soda compress and a thin coat of castor oil can provide relief. Dissolve 1 teaspoon of baking soda in a bowl of cool water, soak a soft cloth and drape it over the burn for about 10 minutes to draw out heat. Once the cloth is removed, pat the skin and gently apply castor oil to moisturize and create a barrier. Frequent reapplication of castor oil in the next few days can keep the area supple while it heals. Of course, deeper burns or large blisters call for immediate medical care rather than self-remedies. Use number 21. Fighting dandruff and itchy scalp. Many older adults feel frustrated by dandruff, which sometimes appears due to scalp dryness or an overgrowth of yeast-like fungi. A homemade solution combines 1 tablespoon of baking soda, 2 tablespoons of castor oil, and a handful of drops of tea tree oil, famed for its antifungal potential. After wetting the hair, the mixture is massaged into the scalp for 3 to 5 minutes, allowed to sit for 10, and then rinsed with shampoo. Baking soda modifies the scalp's environment to be less conducive to fungal growth, while castor oil soothes dryness, and tea tree oil offers antimicrobial benefits. If the scalp remains persistently flaky or inflamed, a consultation with a dermatologist may uncover underlying conditions like psoriasis or seborrheic dermatitis. Use number 22. Body scrub for soft, renewed skin. Few things feel as refreshing as stepping out of a shower, knowing you've buffed away old, dull layers of skin. 2 tablespoons of baking soda, 1 tablespoon of castor oil, and possibly an extra tablespoon of olive or coconut oil create a scrub that can be massaged into damp skin. It's especially helpful on rougher zones like elbows, knees, and heels. Baking soda exfoliates gently, while castor oil deeply moisturizes, and any added oil can enhance the overall spread. One of my elderly neighbors told me she loves how soft her arms and legs feel after using this weekly. The only drawback is a slippery tub floor, so caution is needed. If your skin is sensitive or broken, consider testing on a small patch first, or waiting until the skin is intact. We're only halfway through this treasure trove of tips. Stay tuned because the following remedies may unlock even more comfort and convenience in your daily routine. Use number 23. Brightening nails and addressing nail fungus. Yellowed nails or mild fungal issues are familiar complaints, particularly if you've worn nail polish for decades or have dryness that cracks the nail bed. A simple soak in warm water mixed with a teaspoon of baking soda for about 5 minutes can loosen debris and lighten discoloration. Afterward, some rub castor oil onto each nail, believing that its fatty acids shield the nail surface and discourage fungal spread. For mild fungus, a paste made of castor oil and baking soda is sometimes applied under the nail and kept covered overnight. This approach can be repeated daily for a couple of weeks. If you've had persistent fungus or thickened nails that don't respond to home care, though, specialized treatments might be necessary. Use number 24, lip scrub to combat chapped lips. Chapped lips can be uncomfortable in any season, but they can trouble seniors even more when hydration levels fluctuate. A quick remedy is blending half a teaspoon of baking soda with half a teaspoon of castor oil, plus a bit of sugar or honey if desired. Rubbing it gently on the lips for about a minute exfoliates dead skin, then wiping it away and applying castor oil or lip balm seals in moisture. Some older folks mention they've done this before special events or church gatherings to ensure their lipstick goes on smoothly. If lips are extremely cracked or bleeding, it's better to let them heal a bit first before exfoliating them again. Use number 25. Tackling acne and stubborn pimples. Adult acne is not unheard of, and dealing with sudden pimples can be frustrating regardless of age. In a mild attempt to calm breakouts, half a teaspoon of baking soda and 1 teaspoon of castor oil can be made into a thin paste and applied directly to the spots. Leaving it for about 10 minutes and then washing off carefully might help peel away dead cells, thanks to the baking soda, while castor oil aims to reduce inflammation and combat bacteria. It's important not to overuse baking soda on delicate facial skin, as excessive alkalinity can lead to dryness or irritation. If more severe acne persists, specialized dermatological advice is recommended rather than only home remedies. Use number 26. Removing moles and skin tags. Stories and folk remedies sometimes propose that a mix of 1 teaspoon of baking soda and enough castor oil to form a thick paste can be placed on small moles or skin tags before covering them overnight with a bandage. Some claim repeated applications can dry out the unwanted growth, eventually causing it to fall off. While a few people report success, there is no scientific consensus. Furthermore, any suspicious or rapidly changing mole should be assessed by a professional to exclude serious skin conditions like melanoma. Seniors who have discovered odd growths, especially if they notice color shifts, should prioritize a medical exam. For benign, unchanging skin tags, experimentation is more common, but patience is essential, as it could take several weeks to see any effect, if at all. Use number 27. Relieving menstrual cramps and lower abdominal discomfort. Although it might sound surprising, some older women still deal with menstrual discomfort leading into their later years, or they might have pelvic aches for other reasons. A gentle tummy massage with 2 tablespoons of warmed castor oil and 1 teaspoon of baking soda can be done in slow circles for about 10 minutes to soothe cramps. It is believed that castor oil's anti-inflammatory aspects calm muscle spasms, while baking soda might help ease localized tension. Afterward, soaking in a bath with half a cup of baking soda for about 20 minutes can add to the relaxation. If pain is severe or unusual, it's essential to investigate potential underlying conditions like endometriosis. But for simpler monthly discomfort, a warm castor oil rub can be a comforting addition to your routine. Use number 28. Combating athletes' foot and skin fungal infections. Among older individuals, skin and foot fungi can feel like a persistent battle, especially if circulation issues or dryness complicates matters. A foot soak of warm water mixed with a tablespoon of baking soda, done for 15 minutes, helps soften and cleanse the skin. Thoroughly drying the feet, including between the toes, is the next vital step. Then, a light coating of castor oil can be applied to areas prone to fungus. Some repeat this daily, asserting that baking soda shifts pH levels unfavorably for fungal growth, and castor oil harbors components that discourage fungus. Of course, if the infection covers large areas or extends into the nails with discoloration and thickening, it's wise to consult a professional for more potent interventions. Now that you've learned about these 28 uses, you may be wondering how to maximize their effects or adapt them to your daily routine, especially if you're in your golden years or caring for an older loved one. One key piece of advice from many seniors who have relied on home remedies is consistency. Using a mixture once or twice is rarely enough to see lasting changes. It often takes several sessions, sometimes weeks or months, to notice any significant improvement. Another tip is moderation. Just because these ingredients are generally gentle doesn't mean that overusing them will yield better results. For example, with baking soda, using more than the recommended amount can upset the delicate balance of your skin or overburden your digestive system. It's also helpful to remember the importance of rest and overall health. Hydration, balanced nutrition, and proper movement all complement any external use of castor oil and baking soda. If you experience persistent, unexplained discomfort or unusual symptoms, such as a widespread rash or severe pain in a specific area, it's always best to stop the home treatment and seek advice from a healthcare professional. Most importantly, if you find a particular suggestion that works for you, such as a daily foot soak to relieve tired feet or a simple massage for stiff elbows, follow it at your own pace. Stay attentive to your body's cues, and feel free to share your observations with others. Perhaps you could share a helpful tip with a friend or family member in a similar situation, continuing the tradition of simple, gentle remedies that many doctors and elders have quietly used for decades.